Hey, Strong Mom Society, Coach Joni here. So the whole platform is built on you really understanding your core breathing belly pump and how to integrate it into all of the exercises, all the workouts, everything that we're doing. So what I'm hoping to accomplish today is to give you a little bit more information. I want to show you what these muscles look like in the inner core unit. I want to talk to you about where they're located, what their function is, and then hopefully when you try to put this core breathing belly pump together, it makes a little more sense because you have almost some visualizations about what's happening in your body. So here we go. This is what we often think our core is. We think of it as those Ripley six-pack muscles at the front of the body. And fitness has just reinforced this because you go into a fitness class and they do a million of those crunches and bicycles and twists. And what they're trying to do is work those obliques, work that rectus, and get you this look right here. But this is not your entire core. This is your outer core. What your core actually is a combination of those outer core muscles and your deep core that I refer to as your inner core unit. And it's this combination together of deep core and outer core that makes up your entire core. So if you think of it as just those six-pack muscles at the front that look really nice, then you're leaving out a lot of other muscles and you're only training a portion of your core. So regardless of what stage of life you're in, pregnancy, parenting, postpartum, anything, you want to think about all of these muscles working together as a unit and not just trying to isolate or train one of them. So this inner core unit, let me back up here again. You can see there's 4 muscles listed. One is the diaphragm at the top, the pelvic floor at the bottom, the transverse abdominis, which wraps around the outside, and then the multifidus muscles that line the spine. And those are the ones that we're going to dive into a little deeper. Your first one's the diaphragm, that I will argue is the most important muscle in your body, because if you're not breathing, you're not living, and your diaphragm is your main breathing muscle. Now, a lot of us don't use our diaphragm. The postural changes that happen during pregnancy, that baby grows, it presses up into the diaphragm, and if the diaphragm's weak to begin with, it's really hard to take a deep diaphragmatic breath in the later stages of pregnancy because there's just not enough room for it. So you want to make sure that you start training that diaphragm right away as soon as you even think about getting pregnant. Honestly, I work on this with all of my non-pregnant male clients as well. That diaphragm is a really important part of your core and an important part of making sure that you're using the right muscles in your day-to-day movements. So your diaphragm, if it's not working, your body's going to compensate and use every muscle under the sun to make sure that you get that thorax open and you draw air into your lungs. Without the diaphragm and that compression, that system of compression that it creates, you have to use all your neck, chest, trap, all of these muscles up here that we kind of have chronic strain in our daily lives. They're usually there and present because you're not a good diaphragmatic breather. If you see this diaphragm, it's shaped like a parachute. This is a diaphragm on the exhale. On your inhale, when you breathe in, that parachute or this muscle contracts and moves down into the abdominal cavity, and it suctions air into the deepest part of your lungs. And then when you breathe out, it returns to that dome-like shape. It pushes the air up out of the lungs, out of the body, and the muscle contraction turns off. So, if you think of putting one hand on your belly and one here at the top, as you breathe in, you feel the belly expand, and I want you to just visualize that diaphragm flattening out and moving down. And then as you breathe out, belly pulls in, and the diaphragm returns. Take that one more time. Inhale, belly expands. Exhale, belly returns. And the reason your belly's expanding on that inhale is because that diaphragm creates a lot of pressure down into the abdominal cavity, and it has to push everything out of the way. So that expansion is everything kind of moving out of the way so the diaphragm can descend. And then when the diaphragm goes back up underneath, all those organs, baby, everything can just pull back in towards your spine again. The top is the diaphragm. The bottom of your core is your pelvic floor. And it's your diaphragm's BFF. And I say this because they move in unison. That diaphragm is a dome at the top. Your pelvic floor is a dome at the bottom. And as you breathe in, your diaphragm moves down. Your pelvic floor relaxes. As you breathe out, your pelvic floor contracts and then your diaphragm relaxes and moves back into this dome. So it has this pressure system where it maintains the pressure in your core through every inhale and exhale. And when we think of the pelvic floor, we often just think of it as being one muscle, or that muscle that stops the flow of urine. If you're taught to do a Kegel by just stopping the flow of urine. It's so much more than that. You can see here, this is a network of a lot of muscles. It's a pretty complex system. And when I teach pelvic floor, I teach it in 4 sections. We've got the front section from, if you see here in this diagram, the muscle right in the middle at the top is actually your pubic bone. Your tailbone is the bone here at the bottom. So you've got pubic bone at the top, tailbone at the bottom, and then these 2 bony points side to side are your sits bones. So from the muscles that go from sits bone to sits bone up to your pubic bone, we think of as the front section, your front triangle. And those muscles line around or go around the urethra and the vaginal opening. And then this back triangle, where it goes sits bone back to the tailbone, are the muscles that sit at the back of the pelvis, and your anus is in this back section. So this is front and back. And then side to side, if you look at this diagram, you can see there's like a figure 8 pattern of muscles that go up around the urethra, the vaginal opening, and then down around the anus at the back. So that splits your pelvic floor into left and right halves. And if there is any kind of muscular dysfunction, imbalance in any one of these muscles, and you can see there's a lot here present. This is just a superficial level. There's actually 5 layers of pelvic fascia. There's superficial pelvic floor muscles. There's deeper pelvic floor muscles. So this system has to work in balance because these muscles, you can see, are attached to the bones of the pelvis. And if a muscle is stronger on one side or in one area than the other, it's going to pull. So during pregnancy, when people have, SI joint pain or pubic bone pain, pelvic girdle pain, that pain that happens right there on that pubic bone at the front of the pelvis, or any of the problems that kind of happen in the pelvis are usually related to the muscles in the pelvic floor and things being out of balance. So it's really important that we get that diaphragm pelvic floor motion working in that nice unison, that pressure system, and that we also think about the pelvic floor in these 4 sections, and we start to tune into what those muscles feel like in our bodies, so we can start to determine, do we have an imbalance? A pelvic floor PT is a really great resource for this to get checked. They'll have a better idea with an internal exam, just to really understand your pelvic floor, because it can lead to issues with pelvic bones not feeling the greatest during pregnancy or postpartum. Your transverse abdominis is the 3rd muscle I'm going to cover. This one is sometimes referred to as your TVA for short, for transverse abdominis, or your corset muscle, because it kind of corsets or creates a corset-like structure around the body. It starts at the back and wraps all the way to the front. And this muscle is lining, or it's like a sheet underneath the rectus. The rectus and the oblique systems are on top of this, and then that corset muscle is wrapping around. And that's all I'm going to say about this one for now. This muscle, I do want to say, rectus abdominis is in charge of flexion. The corset muscle moves in and out in this way. So the rectus moves your body, your spine this way, and then the corset pulls everything in and then can also let everything expand. And then the 4th muscle is your multifidus muscles, and these stabilize your spine. They run the entire length of your spine from top to bottom, and run on either side of your spinal column. And we don't really get into these a lot. They're incorporated into our exercises, but it's not really something that you feel or you can really tap into. Sometimes in like a bird dog, we can feel those muscles in the spine, but just know that they're there and they're part of this inner core system, and they're really important, and they are being incorporated throughout the exercises that we're doing. So all of these together make up your inner core unit. And here's just another breakdown. And I love this image of looking at a can of soda, because this core is a pressure system. Diaphragm, pelvic floor, transverse abdominis, multifidus at the back. So if anything is out of whack within this can, if you have a can with no bottom, it doesn't work. You have a can with no top, no sides. So all of these have to work in unison together to make sure that this can or core unit functions properly and can work for you. And then just a visual from my own pregnancy. I have no idea how many weeks this was when I was pregnant with Adina, but this is just an example of what a relaxed inner core unit looks like compared to an engaged core unit. And you can see, all I'm doing here is I have a lift in my pelvic floor. I'm wrapping that corset, practicing that diaphragmatic breath. The picture here on the left is just, everything disengaged and hanging out. So when you are going through pregnancy, you want to keep that inner core unit stronger because it holds that baby closer to you. And this belly here on the left is going to create more strain on my joints, more strain on the pelvis, lower back. So you want a strong inner core unit during pregnancy, and then you want it again in postpartum because it's going to help with aches, pains, and just daily living things, just to make sure that you are using your optimal strength and that everything is functioning in the way that it should. So I hope that helps. I hope it clears up some of the mystery around your inner core unit. And if you have any questions, please don't hesitate to reach out to me. I love to talk about this stuff. I'm a total nerd when it comes to all of it, as you know. And just take this information and, dive into some of the workouts this week and, really maybe go back and watch those core breathing belly pump videos and see if you can visualize all of this working together in one unit. All right. Thanks, you guys. Talk to you soon.